Hi, and welcome back to Psychology with me, Mr. Snyder, and today we're going to begin our discussion of psychological disorders with talking about the anxiety disorders, mood disorders, and dissociative disorders. So, again, learning objectives, no need to repeat those. Types of psychological disorders are divided into the DSM-5 into different classes. And so anxiety disorders are a class of disorders where obviously the primary symptom is excessive or unrealistic anxiety. And anxiety is that feeling you get of worry, nervousness, or unease. And we refer to anxiety that doesn't have any specific or known cause as free-floating anxiety. And so here are some different anxiety disorders. First of all, a phobia. A phobia is when you get anxiety and it's an irrational, persistent fear of a different object, situation, or social activity. There are thousands of these, but some of the more common ones are a social phobia, also known as social anxiety disorder, where the fear is interacting with others and being in social situations where a negative evaluation of you is possible. Stage fright, fear of public speaking, fear of urinating in a public restroom could all be examples of social anxiety disorder. Specific phobias are specific items or objects that are being fear of, like spiders, snakes, heights. Fear of dogs, fear of being in a small enclosed space is called claustrophobia. And then there's a more common different one of these called agoraphobia. And agoraphobia is the fear of being in a place or situation where escape is difficult or impossible. So crowds, people who are agoraphobic do not go into crowds because escaping that crowd might be difficult. And then another type of anxiety disorder is called a panic disorder. This is when panic attacks occur more than once or repeatedly and cause persistent worry or changes in behavior due to those panic attacks. And a panic attack is a sudden onset of intense panic in which you may tense up, you may have trouble breathing, your heart is racing, sweating. All of these are marked symptoms of stress, and you may feel like you're dying at this point, and that actually becomes cyclical in nature because the fact that you're dying makes you more panicked, and then that makes you feel like you're dying more, and so on and so forth. These are usually experienced by adolescent girls and young adult women, although men can have panic attacks as well. This can become a panic disorder when the panic attacks occur more than once and cause persistent worry or changes in behavior. The last anxiety disorder that is classified as such that we'll talk about is generalized anxiety disorder. And this is where just this free-floating anxiety and these feelings of dread and impending doom, along with the physical symptoms of stress because of anxiety, last more than 6 months. These excessive anxiety and worries occur more days than not for at least 6 months. Some disorders that were classified as anxiety in DSM-4 revised but are not in the DSM-5 are OCD and acute stress disorder and PTSD. Obsessive compulsive disorder, you may have heard this in public or in popular culture. You know, people say, "Oh, I'm so OCD," or "You're so OCD." It's not really used correctly, because that just means that the person's really organized. In real OCD, it's a disorder where the person cannot stop obsessing over something, and it creates anxiety that is only relieved by performing repetitive ritualistic behaviors. So a lot of people with OCD, their obsession is germs, and so their compulsions then is to have everything clean and to wash their hands after they touch something. That's the only way they'll be able to not have anxiety over that. And then the stress disorders, acute stress disorder versus post-traumatic stress disorder. Acute stress disorder only happens up until a month, After a car accident or something, you will have symptoms of anxiety, dissociation, which we'll talk about in a second, recurring nightmares, sleep disturbances, problems concentrating, flashbacks and moments, reliving the event in dreams and flashbacks. And that can happen up to a month following the event. This could be war, this could be a car crash, this could be a robbery. Anything that has been traumatic to the person can cause acute stress disorder. Now, PTSD, or post-traumatic stress disorder, has to occur more than a month after the symptoms have to occur for more than a month after the thing. They may not appear immediately. They may occur 6 months or later after the traumatic event as well, but it's the same symptoms. It's just the amount of time that is different. So what causes anxiety disorders? Well, behaviorists basically say that these behavioral reactions are learned, no different than Little Albert. Little Albert was conditioned to fear the rat, so phobias are nothing more than classically conditioned fear responses. According to a cognitive psychologist, they see the thought processes of people with anxiety disorders as being illogical and irrational. Here are some examples of irrational thinking, like magnification, which is believing that situations are more harmful, dangerous, or embarrassing than they really are. All or nothing thinking, which when performance or the way a situation goes, it needs to be perfect or else it's a total failure. Overgeneralization, jumping to conclusions, and minimization, which is giving no emphasis to one's positive events and traits. So all of these can cause anxiety disorders. Biological factors, anxiety disorders do tend to run in family, which means that genetics play a role in the inheritance of one. And in PTSD, we found that you can actually look and see that genetic factors influence two things. It influences the risk of developing the disorder and the likelihood that you will be put into a situation involving PTSD, or involving a dangerous thing that can then cause PTSD. Now, dissociation is the break in conscious awareness, memory, sense of identity, or a combination thereof. We all dissociate from time to time. We all daydream. That's dissociation. We all blank out. That's dissociation. But when dissociation occurs after a traumatic event or after something that is traumatic for the person, couldn't think of another word, it can be when it's used as a way to avoid negative feelings, it can then become a disorder. So dissociative amnesia is what Freud would have called repression. It's the loss of memory for a certain event or your personal information, either partial or complete loss of memory due to psychological causes. So this isn't amnesia caused by a blow to the head. This is caused by repression of the memory. And it's associated usually with stressful or traumatic events, emotional events. Now, dissociative amnesia can occur with a fugue or not. Dissociative fugue is when the person travels away from their familiar surroundings and they lose their personal information. They can't remember it. They may create a new identity, adopt a new career, life. This happens after an emotional trauma, and this obviously increases substantially after wars and disasters. Then we have dissociative identity disorder, also known as multiple personality disorder. This is when two or more distinct personalities within a person's body control their behavior. I believe the average is 8 for men and 15 for women, different personalities, but there have been multiple cases where over 100 distinct personalities live inside a person. And then finally, depersonalization or derealization disorder. People feel detached and disconnected from themselves and their bodies. It's kind of an out-of-body experience. They see themselves in third person. A lot of drug users report having this, or at least symptoms of this, but it also is a dissociative disorder when not brought on by drugs. So what are the causes of the dissociative disorders? In psychodynamic theory, basically all disorders are the repression of threatening or unacceptable thoughts and behavior as a defense mechanism to reduce emotional pain. The cognitive and behavioral explanations are kind of tied together. The person feels guilt, shame, or anxiety when thinking about these experiences or thoughts, and they start to avoid thinking about them, which takes away the pain. So that negative reinforcement means avoiding thinking about them. And then biological sources during brain scans, they have shown that there is lower brain activity in the areas responsible for a person's sense of body awareness. So that may bring on some dissociative symptoms. Lastly, today we're going to talk about mood disorders, and there's only two of them that we're going to talk about. Major depressive disorder and bipolar disorder. And so in mood disorders, the person's mood is severely disturbed. And let's start with major depressive disorder, or depression, as you guys would know it. It comes on suddenly and seems to have no external cause or is too severe for current circumstances. It's more likely in women, and that is true across cultures as well. Could be that women have different hormonal structure versus men. Women tend to ruminate or repeatedly focus on negative emotions. It's just part of their nature. And gender-related differences in society could be to blame as well. Major depressive disorder, it has to not be relevant to the current situation. So if a person's spouse dies, obviously they're going to be sad, but we cannot diagnose them with major depressive disorder because it's relevant to the situation. There needs to not be a cause for a diagnosis to be made. Bipolar disorder, think of two poles, two ends of the pole, two ends of the spectrum. Mood may range from normal to mania, and then depression. Bipolar 1 disorder is when the person goes from normal to mania, and then bipolar 2 disorder is when the person goes from severe depression to hypomania. So we're talking here versus here on the pole. Mania, we would say, is excessive excitement, energy, and elation, or irritability. These people may come in and have the grandest plans. They may sell their house and move to the other side of the country to save the world. It's not necessarily impossible in the delusions, but it is kind of delusional that you could do that. So that is what happens in bipolar disorder, and then they'll swing all the way back to the other end of the pole and be majorly depressed. What's the cause of a mood disorder? Well, Martin Seligman and behavioral theorists link it to learned helplessness, where the person has that they've learned that they cannot improve their situation, which is not true. Social cognitive theorists say that it is, distortions of thinking, where negative events are just so they can't overcome them. They're out of proportion, and they minimize the positive good events that happen, and they develop negative self-defeating attitudes about themselves, which means that it will then go down in a cyclical fashion and get worse. Biological explanations have found that these people have too much of or lack different neurotransmitters such as serotonin, norepinephrine, and dopamine. Genes also play a part because disorders appear in genetically related individuals at a higher rate. That's all we're going to talk about as far as anxiety, dissociative, and mood disorders go. Next time we will talk about eating disorders, personality disorders, and schizophrenia. So be ready for that. Fill out your learning targets, and I will see you later. Bye-bye.